Here's why I love AIA Private Health Insurance. You're incentivized to be healthy, and they actually give you money back if you achieve health targets, and they're realistic to hit too, even for someone like myself who can very easily fall into bad habits. Those incentives also build healthy habits, and it's helped me lose a fair bit of weight so far. So far, I've lost 13 kilos or 28 pounds in 4 months, and now not all of that is because of AIA, but it has helped. Look, AIA might not suit you, I'm not affiliated with them, so I don't care if you move to them or not, but if you take anything from this video, if you do have private health insurance, check your policy regularly and understand what you are covered for, which is a lesson I learned the hard way. And with that said, here's why I love my new AIA policy. I had a horrible experience with my previous private health insurance, and I genuinely thought the whole idea of private health insurance was a scam. So my perspective of AIA is a little bit warped by the fact that I was so badly burnt in the past. I've been dealing with a pretty intense ongoing medical issue for the past 2 years now. As a result, I've had to get multiple surgeries, and it's a whole topic for another video. But during that process, I discovered the previous health insurance I'd been paying for didn't cover any of it, and in my opinion was pretty much completely useless. Fortunately, in Australia, I can still use the public system, but there is a big difference between the public and private hospitals, especially when you have an ongoing issue that is disrupting your life. At the age of 25, I had to leave my parents' health cover and I had to find my own, and I signed up to another company and just stayed on it for years. The policy I was originally on got moved to a different one, and in my opinion, the policy I was on essentially covered nothing. There was a handful of things that it covered, but they were extremely rare to happen, especially for a young person, even though they say that this is what young people want. It should also be said that in Australia, you're almost forced to get private health cover at a certain income level, otherwise you have to pay more tax. And unfortunately, I think too many people just take the cheapest or easiest option and do it because they kind of have to, not based on proper understanding of the options, because they can be very confusing. It honestly feels like you need a medical degree to understand some of the differences. I feel as though the policy I was on provided little coverage for the price, and it seemed more to be only useful to avoid the extra tax, and as I told them in my complaint to them, I feel the name was completely dishonest and should have been more representative of its lack of coverage. And I think it's important to mention that when I went to a private hospital to get a consultation, they told me I was covered at first and would just have to pay small out-of-pocket fees. They booked me in, and then when they checked it, they called to say you're not covered and you need to pay for this. Noting that I had given the hospital my policy details up front, which says even the private hospital didn't know that plan was so bad. What really annoys me about it is that I was paying so much and could have paid less elsewhere to actually be covered for this issue. At that point, I looked into what else was available, and at that point is when I found that AIA had an 8-week free program and found out about the Vitality program. The idea of having incentives to be healthier is pretty cool. To be brutally honest, the extra motivation to be healthy is something I need personally to keep going. I've always been the on and off type person with diets and exercise. Sometimes it would go on for months and even 6 months, but then eventually I would fall off. So having something that actually gives me a real motivation to keep up really helps. Some of the stuff to get points at the start is quite easy, and it's just basic stuff like answering questions about yourself and your health. Some of the other easy points are for getting checkups and assessments, which is nice too, as those are the types of things you can put off or ignore as not urgent, but can help ensure your health is in check. But once you do get those initial easy points, it then becomes more around activity-oriented points. So for instance, to start off with, it set mine at 200 points in a week, and I can choose from multiple options for incentives, and I chose to get $5 cash back. Now I know $5 isn't much, it's like one coffee, but it's actually quite a really good motivator I've found. Then once you start to achieve the 200 points, it then does start to require more, and now I'm up to 500 points a week, which it has progressively been pushing me up to. To get these points, I can get 50 points for walking 7,500 steps. If I do 12,500, I get 100 points. Or if I do physical activity burning over 300 calories for 30 minutes, I also get 100 points, which is the one that I go for usually. The steps and activity get tracked on your phone, or I bought a Fitbit as more of a commitment to trying to get more healthier. For a financial comparison, my old plan for me and my wife would cost about $134 every fortnight, but as I said, it barely covered anything, in my opinion. The sole value in the old policy for me, in my opinion, was to avoid the extra tax levy. With AIA, my wife and I together, we pay $170 a fortnight. As I said, we get the $5 back each per week. So with this, we get $20 a fortnight back, which actually means that we pay $150. However, with this policy, we do get a lot more coverage, and more importantly for me is that my current issues would have been covered. However, as with any provider, it takes 12 months for it to be covered under the new policy since it's an existing condition. So the few $100s extra we pay for this a year would have covered thousands of dollars of extra services. Then when you factor in we got 8 weeks free from the promotion, the first year is actually quite compelling too. Look, maybe AIA doesn't suit you. As I said, I'm not affiliated with them, so it doesn't really affect me if you switch to them or not. But what I would say that I've learned the hard way is that you should check your private health insurance as much as it might seem like something you don't need to worry about, because you might be surprised at how much you're not actually covered for, and you might be paying a lot for not much coverage. And personally, the extra incentives work well for me, and I would certainly recommend AIA if you need that extra incentive. Have you had an interesting experience with private health cover, or do you think there's someone better I should look into? Let me know in the comments, I'd love to hear about it. And as always, if you enjoyed this, chuck me a like and subscribe to see more like it. And as always, good luck. Make sure to stay healthy, and if you've made it this far, you'll probably enjoy one of these other videos.